I'm here at Walsh Urology in Rancho Mirage, joined by Dr. Youssef Tanagho. How are you?
I'm doing well. How are you?
I'm well. Thank you so much for having us.
Thanks for joining us.
Of course. So my first question for you is, take a minute, tell me a bit about your education and training.
Okay. I did my college at Stanford University. I graduated with a Bachelor of Science in Biology and a Bachelor of Arts in Anthropology. And I also did a Master of Arts in Anthropology at Stanford. And then I did my medical school at Dartmouth in New Hampshire, and I did a Master's of Public Health at Harvard University. I did my residency training at Case Western Reserve University and my fellowship in minimally invasive surgery at Washington University in St. Louis.
Geez, so you've literally been all over the country.
I've been all over the country, and we have roots in California, and now I'm back home.
Well, we're kind of lucky to have you here.
I'm fortunate to be here.
Wow.
We love the location.
That's quite the list. Well, I'm glad to hear it. Okay, let's jump right into it. So tell me, what are some of the common men's urological conditions that you treat here?
Well, we treat BPH, which is enlarged prostate, and all the symptoms that come with it, such as frequency of urination, weak urine flow, urgency, leakage of urine, waking up at night to urinate. We treat erectile dysfunction, low testosterone level. We treat kidney stones, bladder stones. We treat all types of urologic cancers, such as cancer of the kidney, cancer of the bladder, cancer of the ureter, cancer of the prostate, cancer of the testicles. We treat infections and inflammation of the prostate. We call it prostatitis. Recurrent infections of the urinary bladder. We treat interstitial cystitis, which is a type of inflammation of the bladder, blood in the urine, burning with urination. These are some of the conditions that we treat.
That's a lot right there, and I'm assuming much more.
Much more.
Okay, so tell me, give me an idea as far as the advancements in treatment and how you would treat some of these conditions.
Yeah, so I specialize in endoscopic surgery, so minimally invasive techniques. The vast majority of the surgeries that I do are without incisions. I use cameras to manipulate, to visualize the urinary tract and to treat common conditions such as kidney stones with using laser energy, as well as BPH. I use a technique called green light laser vaporization of the prostate, where I use high energy laser to melt the prostate like butter, basically. And that opens it up and allows people to urinate much better.
Wow.
The vast majority of the surgeries that I do are outpatient and have a very quick recovery because there's no incisions involved.
It really is the future of medicine. So take a step back. You have a machine that is able to actually, like a camera for kidney stones?
Well, we have a camera that, a scope that goes through the urethra into the bladder and then can go up the ureters into the kidneys, and so we can see the entire urinary tract with a camera without making any incisions.
I see.
And then we can treat common conditions such as bladder cancer, kidney stones, enlarged prostate, all through this camera technique.
Can you show me some of the equipment? I know you're not referring to just that, but I know you have some cool stuff you want to show me.
Yeah, I can show you some of the visuals that we use to explain to our patients, about kidney stones, for example.
Let's check it out.
Prostate, sure.
Let's do it. All right, doctor, so here we are in front of this whiteboard. You're going to show me some stuff.
Yes, so this is a bladder.
Okay.
This is the prostate, and this is the urethra. So when the urine is pushed by the bladder, it has to go through the urethra, which is surrounded by the prostate. As the prostate gets enlarged and gets bigger and bigger with age, it starts to compress the urethra, making it very difficult for the urine to pass. So what we do is we go in with a camera through the urethra, under anesthesia, and using laser energy, the green light laser, we start to vaporize this prostate tissue here. As I said, melt it like butter, and that now creates a wider channel for the urine to flow.
All right, well, I really appreciate your time, Dr. Tanagho.
Absolutely, my pleasure.
I learned a bit. I learned actually a lot today. So you know where to go. Walsh Urology, talk to Dr. Tanagho if you have any issues with your prostate or bladder, and make sure you get yourself checked up. It's important. But again, big thanks to Dr. Tanagho and a big thanks to you. We'll see you after the break.